if we want to start talking about healthcare reform, allow me to throw in a few thoughts, if you would. The first one is, all ideology aside, if I sit you down in a room and we'll just say that you're an efficiency expert, you're an efficient person, I can give you a household budget and you can go through it and figure out how to turn, something that's in the red in the black, cut here, get a better deal on that there, all these kinds of things, right? You're an efficiency expert, and I'm going to sit you down and I'm going to throw some cold, hard facts at you. And I want you to draw some conclusions, if you can, from these facts. Now, understand, numbers like the kind of things I'm going to throw at you now, especially comparing over country to country, there are variables involved. Different peoples are different. They eat different foods. They do different things. Lifestyles are different. So there's variables. You have to understand that that's why close comparisons are difficult. But when comparisons are hugely one-sided, you can throw the variables out the window and you can draw some conclusions. So if you wanted to compare the U.S. system, and there's a number of countries that are considered to be comparative, comparison worthy with the United States system. So I went online and looked at a bunch of different sites, that were comparing and contrasting. There are some good, highly sourced numbers from a bunch of these places, but start with like the Commonwealth Fund, which is a group that promotes, healthcare. So, they have an interest in pointing out the problems in the system, but the studies are well sourced and all that kind of stuff. And they're sobering. If you haven't looked at the healthcare numbers for the U.S. compared to other countries, you ought to do that before you even discuss the issue, because somehow that needs to be explained away, dealt with. You can't sweep this under the rug. Start with a few facts. The first fact is sobering in and of itself. And I took this quote directly from the website because, the U.S., compared to the other countries in our category, is the only one without, a government healthcare system, right? So theoretically, they should all be spending a lot more of public funds on healthcare because, we do it privately more than they do, right? Here's a quote, though, from the website. Quote, even though the U.S. is the only country on the list without a publicly financed universal health system, it still spends more public dollars on healthcare than all but 2 of the other countries on the list. That's stunning, right? In other words, only 2 of these countries, all of the government healthcare countries, spend more public money on healthcare than we do, and we don't have a government healthcare system. Not a universal one. We obviously have a patchwork of things, Medicare, Medicaid, all those kinds of things. The other countries, by the way, that are considered to be comparable to the U.S. for the purposes of this intro conversation, Australia, Canada, Denmark, France, Germany, Japan, the Netherlands, New Zealand, Norway, Sweden, Switzerland, and the United Kingdom. Okay? In the year 2013, which was obviously before the Affordable Care Act took effect, and even now the numbers, you don't have enough numbers on it over time to get good looks at what it's changed, but it hasn't changed the basics, I think. And coverage numbers will be different, and that will lead to other realities, but these broad numbers are probably still pretty accurate. In 2013, the U.S. spent a bit more than 17% of GDP on healthcare. 17%. And of course, that means nothing unless you know what other countries spend, right? How does that stack up with the other nations on our comparison list, right? Well, 17% of GDP is number 1 on the list. USA, 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 right? Number 2 on the list was France at 11.6% of GDP, right? 50% lower. So the distance, like I said, variables sometimes can come into play, but when you're 50% higher than the next competitor, the variables just fall away. Something's wrong with that number, right? France spends 11.6% of GDP on healthcare. The UK spends this is 2013 numbers, 8.8% of GDP. Folks, that's half. That's half what the U.S. spends. If I'm sitting you down with a piece of paper and I'm going to throw a bunch of numbers at you and ask you to draw some conclusions, the first one is that. What do you make of that number? Now, add to that what Americans privately pay for healthcare, right? the insurance premiums that come out of your pocket, that's all part of the overall healthcare cost, right? It's not a government expense, it's a you expense. Out-of-pocket stuff, co-payments, all that stuff, right? How do we stack up? Well, it's not going to be good because we're the only one on the list without a universal healthcare thing as part of their system, but, let's see what the numbers look like. The U.S. towers over the number 2 competitor in this category as well. Canada, by the way, is the number 2 with the highest insurance premiums, out-of-pocket expenses, co-payments, and all that stuff. But Americans spend 5 times more than our friends north of the border. So we in the U.S. spend 5 times what the number 2 country on the list spends. Again, the variables that you could say, well, Americans do more of this or less of that, doesn't come into play when it's that big. Again, if you're just working on a few numbers that I give you, that's the second one. What do you make of that? So what are we getting for our money? That's a good question, isn't it? You go and you look at the list, and of course the healthcare professionals all have a bunch of different stats that they use as part of an overall panel of assessment to determine how a country's doing. And it's the standard stuff we see everywhere. Infant mortality, life expectancy, and whatnot, right? And on that list, we don't do very well either. So these countries that are spending dramatically less are scoring higher than the U.S. in most categories. In some categories, they are running away with it compared to the U.S. The U.S. does pretty well on cancer care, though. Let's point out where things are good. These, of course, as I said, are 2013 numbers I'm using. Newer numbers are going to be slightly different. But the point overall is that if you're going to spend that much more money, one would hope for a corresponding rise in what you're getting for the cash, right? But if you are spending so much more than your competitors and they're actually delivering more in results, again, you're the efficiency expert with the piece of paper and I just give you a few numbers to work with. Plug that into your equation. And how does that mess with your thinking, right? So you might say, well, wait a minute. All right, well, what's different? Start looking at specifics, right? If we got these different cost disparities, what's going on, right? So the first thing you may look at is, all right, well, let's look at the stuff that this money buys, and let's look at what we pay for it versus what these other countries pay for it. And this turns out to be rather interesting. Take, for example, heart bypass surgery. Just an example to show the rule that procedures are a lot more expensive in the U.S. than in any of the other countries on that list. And again, allowing for variables is fine, but 40% higher in terms of the cost of the surgery than the number 2 country on the list. So the U.S. is exceeding the next highest competitor by a ton in all these categories. Average cost in 2013 of heart bypass surgery was listed as $75,345. The second highest on the list was Australia, where it was $42,130. Boom. Okay. There's a prime suspect, right? Procedures are more expensive in the U.S. Okay, we'll put that aside now. What else? Well, didn't turn out to be visits to the doctor because these other countries generally had their people going to the doctor more for checkups and routine visits and what have you. U.S. folk in general saw the doctor quite a bit less. So it's not going to doctor visits. It also is not because Americans get hospitalized more and that costs more because the Europeans were actually going in the hospital more, maybe having procedures done or whatever. And by the way, I should point out, because I can hear the Europeans grumbling in my ear from here, that if you go to any of these countries on the list I just mentioned and start talking about the government healthcare system, you're going to hear gripes, because that's human. Took me 4 months and then they did this. And you hear it anywhere in the world, everywhere in the world. Okay. From most people, not all people, but most people. The problem is if you want, for comparison purposes, offer them a trade. Go to any of these countries after you hear how long it took to get that knee replacement surgery done and say, well, listen, want to trade with us? I've never met a person who didn't say, oh, no, I'll stay with what we have. I want it to be better, but I'll stay with what we have. In other words, they're cool. They like it pretty well. As I've said many times, I'm fine replacing the Affordable Care Act with something better. But it's got to be better. And not better for the stakeholders in the entire healthcare industry, because the only stakeholders that should matter, and I'm going to repeat this because I feel this way in a number of different areas, it's a huge problem. The only stakeholders that should matter are the end users. the people, from whence all the money to pay for all of this, ostensibly comes from, the taxpayers, right? Not better for all the people in the supply chain so that they can make a profit. And I think the profit motive is wonderful in some areas. For example, I've been convinced for many years that the United States' ability and pharmaceutical companies' ability in this country to develop new drugs is wonderful, and it is in large part, fueled by the carrot and sticks of the free market, right? It's a high risk, high reward gig, but it distorts the market somewhat because you have to say, okay, listen, if you make this wonder drug, we're going to make sure only you can make it for a while after you initially make it to protect the investment you put in. Okay, but I get that. And I think in the end somewhere, we're better off for it. But so much of the rest of the healthcare market does not follow the typical, free market dynamics that are so often cited. Oh, we'll get a competition going in the States and blah, blah, blah. Folks, it's not breakfast cereal. It's not breakfast cereal. And that's the problem, okay? Because unlike most goods and services out there, you do not, and most people would simply not be willing to go, for example, for the cut rate doctor. This guy's or gal is definitely not as good as the competition, but he's 50% cheaper, so that's who we're going with. Not in that free market. Not if you can help it. Not if you can sell the house and the farm and everything else. You're not letting that person operate on your child. You'll give your whole life up and live as a pauper rather than do that. So it's not like, I'll forego the breakfast cereal because it just is too expensive right now for Lucky Charms. You don't save up and cut coupons to get 20% off that doctor treatment. Don't wait for a sale on brain surgery. It just doesn't work that way. It's a different kind of market. It's a life or death market, too. Because of that, trying to say you can fit all problems and solutions into the same template, for example, treating this market, the healthcare market, the same way you would treat a commodity market, it doesn't work that way. And if it did, wouldn't our numbers be lower because we're a heck of a lot more free market than these other countries? You may say we're not very free market at all, but we're a heck of a lot more free market than any of those other countries, when it comes to their healthcare policies and the way that they deliver it. And ironically, as I said, even with that, we spend more in public money on healthcare than all but two of the countries on that list. What the hell's going on? And once again, I do not want to make these healthcare systems in these other countries out to be panaceas. I'm not saying they don't have problems. I'm not saying they don't make the news for cost overruns or scandals in this and that department and griping by the people who are the end users. I mean, I think it should be considered to be a fundamental thing that must be present for it to be considered officially a healthcare system, that the end users gripe about its shortcomings. So I'm not trying to make these things out to be a panacea, just going on the measurables here. The reason Americans have been told that they shouldn't go the route of these other countries is because it's going to cost a lot more, and or you're going to have a worse end user experience, and the raw numbers don't seem to show that at all. And I don't think anybody would trade their system for ours. So we'll draw the conclusions we can from that. Forget fake news, alternative facts, anything like that. Draw your conclusion from basically that.